Anybody need some hand sanitizer before we start? We'll squirt. There.
Better safe than sorry.
I'll be here in 4 hours anyway, so I might as well take my regular seat.
You back here. John, you can probably take a seat up here too. Chief, you want to come up and have a seat somewhere?
Jim, can you get those switches up there on that side?
Pete Gulls is going to be in the other room. He's going to televise us. I think he would start, do an intro. Maybe you do an intro as well, or say hello.
Sure. Yeah.
And then we'll kick it to Joe. We don't want Joe to be out by himself on that side, do we?
You want us on this side, Dave?
That wasn't the plan originally.
Yeah, I think so. So we go over here.
Yeah. Yeah, when we do kick it over to you, whoever speaks, make sure you say hello, introduce yourself, tell them what department you're with so that people watching at home know this may be the first time they get to meet you. Hopefully that's not the case, but. Hi, Stu. Pete's in the other room, ready to go.
On air.
Okay. Yeah, you want to close the door? Slow, sure.
Oh, there we go.
Good afternoon, everybody. My name is Don Humison. I'm Mayor of Westfield, and thankful to have all of you here in the room this afternoon to do a little informational briefing on the situation that's affected our city and across our Commonwealth and across the nation, the coronavirus, and how it's impacting our constituents and our citizens. We thought we'd have, although we've had several meetings previous to this, we thought we'd do a meeting today where we could do it on television and then rebroadcast it on Channel 15 so that folks at home could be watching and seeing what we're doing. So what we're going to do is ask each person today who presents and gives any kind of information on behalf of the department here in the city to introduce themselves and talk a little bit about what they're doing. We can kind of have a free conversation across the table if that helps, just so that everybody gets a chance to get their information out. We will also be continuing these sessions with conference calls so that we don't always have to be together in one room. Although if anybody is looking for any hand sanitizer, we've got it right here. But we're going to be doing these on a daily basis that I think Jim Wiggs is going to set up for us. So Jim, is that right?
That's right.
Good. Councilor Bean, thanks for having us in your house. Say hello.
Thanks, everyone. Obviously, Brent Bean, City Council President this year. Just have the ability to represent the City Council as a whole. We've been in constant contact lately just to kind of keep the government moving within, the city limits and some of the open meeting law dispensation that we're seeing and relieving some of those rules and regulations up so we're not congregating as full groups. Our plan moving forward, and we haven't made an official decision yet, but we're looking to keep our City Council meeting open on Thursday. It probably will not be open to the public. We do have video, obviously with Pete Cole's going on right now, is that because it's videotaped and some other parameters that we'll meet where we can have a meeting without the public being in it. There are some talks about subcommittees. How do we deal with subcommittees? Because of the emergency, subcommittees might not have to meet, and then just literally bring out any agenda items for Thursday right out to the floor as a whole. So we're doing that obviously to minimize any kind of contact. I know at first glance you think, well, maybe we should just cancel, city council meetings and so forth. There are things within that agenda that need to be passed. Yes, funding is one thing, especially on an emergency basis. The mayor can obviously take care of a lot of that, but there is some personnel that we need to reappoint and so forth. And, it's hard. We don't want to slow. It's hard enough for businesses out there too, and for residents. So we don't want to slow those processes down. If it's an agenda item that a person needs to come in and have a discussion with the council, then we will obviously let them come in and explain their situation. But outside of that, it looks like we're going out with no public for Thursday, and probably even going even further and saying no subcommittees. So that's kind of where we are. I mean, outside of my role, I just want to help with everybody being on the same page, moving the city forward, getting stuff back up online, just explaining what all the departments are doing, because the city does have their hands around the situation. We just got to get in gear and start explaining what we've already done. I know there's the health experts and department heads around the table will have their moment here, so I don't know who likes to go first, but if you guys could introduce yourself and just give an explanation on what's your role and where we are today.
Why don't we kick it over to Joe Rouse from the Board of Health?
Okay. Hi, good afternoon, everybody. Joe Rouse. I'm the Director of Public Health with the Westfield Health Department. And I just want to let you know where we are with everything. Certain things I'll leave unsaid so that the schools can discuss their part, emergency management, police, and fire. But to let you know what we're doing in the health department right now is that we're constantly in contact with the CDC and also with the Mass Department of Public Health. So we're getting our guidance from them. Not a lot is different in the city as is being discussed or posted by the governor or regulated by the governor. So our role right now primarily is to continue to disseminate information to the public in two ways. One, to let you know that we are actively pursuing this to slow the spread of this virus. So none of us are foolish enough to think that we're going to stop it. But what we need to do is slow it as much as we can so that we can not overload our resources in hospitals and police and fire. So one of the ways to do that is, again, this has been said time and time again, but the regular everyday precautions that we're still encouraging people and will, in any flu season, but particularly now, hand washing, hand sanitizer, don't be careful with the touch point surfaces. Try and use a barrier wherever you can when you're touching things like an elevator button or a doorknob. And avoid touching your face. That's a huge one. So, I mean, you can have dirty hands as long as you don't go to your mucous membranes. You will probably be okay until you get a chance to wash your hands. So keep all that in mind. Avoid crowds, and this is where we've kind of launched into a different area now where the governor had, he limited gatherings to 25 individuals and is prohibiting on-premises consumption of food or drink at bars and restaurants, which we will monitor that. And if we need assistance, we'll notify the Westfield Police Department. Also, again, avoid crowds, avoid all non-essential travel. The next part of it that we're doing in the health department with our nursing division and through the state epidemiologists is that we will be monitoring any of and doing investigations on any of the confirmed cases that we get in Westfield. This is a very laborious task. There's a lot of details and questions involved with it. So if you call our office and we're not readily available, please be patient and we will get back to you. The other thing is we also will be in contact with any of the residents who are under self-quarantine requirements to confirm that the proper procedures and protocols are being followed. So that particular part of it is very much overwhelming for us, but we will do the best we can. That's one of our things that we're mandated to do. There are state isolation and quarantine protocols that we just want to make sure people aren't violating that. So other than that, there's all information through the CDC website, mass.gov, State Department of Public Health. Also, World Health Organization is a great resource. The good thing about all the information on those websites is it's all consistent. And whatever we post on our website will basically be a mirror image of that, and unless things change specifically for our state, and we'll update that as well.
Joe, thank you very much. Anything else? All right, Jim.
I'm good.
Jim Wiggs, want to say a few words?
Sure. Hi, I'm Jim Wiggs. I'm the Director of Emergency Management for the City of Westfield. As of 2 p.m. today, the mayor has signed a declaration of emergency for the City of Westfield. What this does is basically allows us to remove some barriers that we normally may face when we go to acquire something through purchase or anything. And also, if we need to take additional guidelines, if this was to worsen suddenly or something, we've got some flexibility now with the declaration of emergency. This is in the guidelines of Massachusetts Emergency Management Agency and the Federal Emergency Management Agency. In addition to that, we're working very close with Department of Public Health to ensure that we're consistent in any messaging that goes out, along with public safety. And in those guidelines, starting tomorrow, Joe or I will be hosting, or we will be co-hosting a conference call that will ensure that our city departments are getting updated information, that if there's any needs that they have, they can voice those needs at that time, and we can address those as we go forward. And that will also ensure that information that we deliver out to the public is consistent, and that we're all on the same page, and we understand we've got a good pulse on what's going on throughout the city by the input of all of the departments in the city. And that will begin tomorrow.
Good, thank you. Stefan, how about you speak next, if you don't mind?
Absolutely. So my name is Stefan Zaporowski. I'm the superintendent of schools. We actually sent out a couple of additional robocalls this morning to our staff and students to keep them up to date as to where we are. Originally, we had agreed last Friday to close the schools through March 27th, and of course, the governor's press conference the other night gave us through April 6th. So now schools are closed through Monday, April 6th, with an expected return date of Tuesday, April 7th. We have, I know on Friday, some of our teachers have distributed our Blizzard bags or alternative structured learning day bags. We are asking the rest of our teachers to send those out today or tomorrow. They are also available online on school websites and the district website. And these are enrichment learning activities. They are not required in terms of being graded, but we are trying to promote the learning or the continued education and enrichment of our students. And again, this is coming directly from the Commissioner's Office from the Department of Elementary and Secondary Education. We're also working, our district is working to prepare additional enrichment resources for our children to do at home during the next 3 weeks. We'll be updating our website with that information, and we hope to have the resources and updates available by the end of the week. We are encouraging families to use the time to read, exercise, and spend quality time together. In terms of our teaching staff too, we realize they have some personal belongings and items they may need to be available to students online. So we have opened up today from 1 to 3 and tomorrow from 8 to 10 a.m. for our staff to go into the building and retrieve what they need in order to be able to continue at least some sort of education while we are out of school. And again, I think I just want to mention too that tonight we do have our school committee meetings, and so we are limiting. We can't have more than 25 people. So at the 25th person, for people who plan to attend, I apologize, but we aren't going to be able to allow you in. But we would encourage people to watch our meetings because they are broadcast on Channel 15 as well. So with any questions, and please feel free to call the school department office today. But after today, our schools will be closed and not accessible. And central office is the same thing will happen with our central office.
I want to recognize too that in the audience, school committee member Bo Sullivan is here. We also have city councilors Bill Oniski, Jim Adams, and Mike Burns from the city council. I think I'm missing anybody else.
Nick, you got Nick too.
I'm sorry?
Nick Morganelli.
Oh, I'm sorry. Councilor Morganelli is in the back videotaping. How's my hair? Does it look good? All right, good.
Can I say
And
one
of course,
more
Counselor,
Can I just add one more thing?
oh, sure, good.
Sure, I apologize. We're going to be sending, like I said, we sent out robocalls and emails. That will be our primary mode of communication for the next 3 weeks. So I just want folks to please check their emails regularly, and if you see a call from Westfield Public Schools, it's probably important. So thank you.
Tina, would you like to give an update on what's going on with the Council on Aging?
Sure. So my name is Tina Gorman. I'm the director of the Council on Aging / Senior Center. So we're actually approaching this from kind of a twofold area. So the first thing that my staff and I tackled over the weekend were the programs and activities and the meals that happen actually at the Senior Center. So we are leaving the doors to the Senior Center are unlocked. However, we're not having any of the group, social, or any of those programs or activities. So those are discontinued for at least the next 2 weeks, but probably into April. So stay tuned for that. As we clean each room and sanitize each room, that includes the games room, the fitness room, the creativity, et cetera, those will be closed off. So today was really the last day for people to come in and kind of wander around, and that will cease as of tomorrow morning. Any of the special events have been canceled or postponed, and we will be calling people to let them know how we're going to be handling that. We have a plan for both of the 2 events that we had coming up, so we'll be contacting people by telephone. I guess the biggest thing are the meals. So we cannot do a congregate meal program at the Senior Center because obviously we have far more than 25 people gathering at any one time. However, we will be doing a curbside takeout meal for the seniors. So the protocol for that will be that you need to call us between 8:30 and 10 o'clock in the morning. Let us know how many meals you want to pick up. And then you can pick those meals up between 11 and 12:30 that day. I will have staff located throughout the parking lot so that we have a traffic flow, because we'll be using the menu that's currently in the Voice of Experience newsletter. Of course, right out of the gate, first day, it's meatloaf on the menu. So we are expecting a large group of people driving in to pick up their meatloaf lunches. So just make sure that you call us between 8:30 and 10 in the morning. You just have to leave your name and your phone number. We'll put you on the list. When you come to pick up your meal, it's the same $3 as it had been. It's the same menu that's in the newsletter. We'll collect your $3 and we will hand you your meal, and then you will drive off and enjoy it at home. The meals, and just to note, the meals will be cooked, but you are going to have to heat them up when you get home, because there's really no way for us to keep them hot during that hour and a half that you have to pick them up. And I would encourage people to kind of pace themselves, so not everybody has to show up at 11 o'clock. If you've called in and you make a reservation, we will have a meal for you, even if you pick it up, at 12:25. In terms of our services, the AARP tax assistance unfortunately has been discontinued until further notice, and that was not our call, that's AARP's call. They are awaiting official notice to see about a possible extension of the federal and state tax filing deadline. We don't have final word on that. If that extension is, if that extension is granted, then it's all going to depend on whether or not AARP can get the volunteers to come in during April, May, June, or whenever to do taxes. So we are sorry for the inconvenience. We are calling every single person that was left on the list to have their taxes done. One of the seniors today, I thought, put it very well when she said, in the scheme of things, having our taxes done right now is probably not, foremost in our thoughts. So we appreciate your patience with that. Our Senior Benefits Coordinator, Karen Noblet, will be conducting all of her SHINE meetings over the telephone. Again, that was mandated by the state. So our original intention was to leave that available, that people could come in. However, we got notice on Saturday afternoon that all of those meetings will be done on the phone. So Karen has all of her appointments set up. She's in the process of calling people just to let them know that those appointments will remain as scheduled, but she'll be doing them over the telephone instead of in person. We originally had planned to have our wellness nurse, Mary Ellen Asher, at the center 2 mornings a week just to continue to do wellness checks. However, Mary Ellen's not going to be able to do that for the next couple of weeks, so that one's off the table for right now. We will continue to offer the medical equipment loans at the senior center, so if people need to borrow medical equipment, we will continue with that program. You can come down to the senior center and get the equipment that you need. We ask you to call us in advance just to make sure that we have what you need. If you're returning medical equipment, the new protocol for that, and there is a sign out on the porch, is that you'll just leave the piece of medical equipment on the porch so that we can sanitize and disinfect it outside. But then just come into the senior center, check in at the greeter's desk, and just let us know who you are and what you brought back so that we can check you off our list and we're not calling you in a month asking where the wheelchair or the shower bench is that you requested. As always, we have been saying this for the last 3 weeks, and I know Joe has been preaching this as well. If you feel sick, please stay home and avoid close contact with others. I think the seniors need to remember that they are the most vulnerable group, and we would also encourage you, and as difficult as this is, especially during this time, stay away from your grandchildren, because the reality is that they could be infected. They may feel fine, and they may be carrying the virus and not even know it. So we're really encouraging you to do that. The next thing I said at the beginning was that we were tackling this 2 ways. One had to do with the actual senior center and people who generally use the building. The other is that we have a lot of homebound seniors. So I'm working with Joyce Peregrine, our companion program coordinator, and Joanne Artegas, our outreach coordinator. We have come up with a few guidelines for our current clients. We will not be transporting, the volunteers will not be transporting people for like their grocery shopping. However, we have compiled a list, and we have about 30 volunteers that are still willing to go out and do grocery shopping for other people. So you'll be handing them a list at the door and the money, either a check made out to the supermarket or cash. They will go do your grocery shopping for you and bring those groceries to you and hand you the bag so that they won't be going in and out of your home and they won't be transporting you. We are also looking at our list of those who typically get medical transportation. We have a long list of people who are scheduled. Joanne Ortegas has been phoning them, and we are, other than extreme emergencies, we are not doing medical transportation, especially for routine follow-ups, things like that. People have been very good about saying, yep, I'm calling my medical provider, that appointment can get pushed off a little bit. We're prioritizing too, and my plea right now is to families. We are a staff of 14. We have 8,000 older adults in the city, so we are really asking the families to step up to the plate, help out with grocery shopping and things like that. We are prioritizing those older adults who have no family in the area and those who are most at risk, those who are either with physical challenges or, whether it's limited vision or limited mobility, and those are the ones that we are prioritizing to help out first. And lastly, I will say, as this continues to unfold, we just got this in from the Executive Office of Elder Affairs, which is a bit disheartening, but you're going to have to start to really be careful of what we're calling the coronavirus scams, which I'm sure the police department is aware too. So, and they are definitely focusing on some of the seniors with, websites that look like they're from the CDC and the World Health Organization, asking for charitable donations during this time of a crisis. So, just ignore them for now. We know that you want to help out, but until we know whether they're legitimate or not, I would say to really avoid all of that. So again, our main thing is that if you're interested in getting a meal, just call us at the Senior Center. The number is 562-6435 in the morning between 8:30 and 10, and then you can come and pick up your meal between 11 and 12:30. You won't even have to get out of the car. We're going to take it out there for you, and that will be starting tomorrow. I think that's it.
Thank you, Tina. Appreciate that. Chiefs, anybody
Yes.
want to give an update?
Thank you, Mr. Mayor. Patrick Egloff, Fire Chief, City of Westfield. Just want to let everybody know in the city that the fire department currently, we're running on all cylinders. Everything is going well. I can't say that it's business as usual, though. We have made some changes to how we do business in order to combat the COVID-19. We are currently following CDC, DPH, and OEMS guidelines. I ask all the listeners and viewers, please call your primary care physician first. don't call the ambulance first. Don't show up at the emergency room. In this situation, the first responders are the ones that we need to keep healthy. If everybody's calling for an ambulance or showing up at the ER, it's a higher likelihood that the first responders are going to get this, the more they're in contact with it. What I recommend is, as I said, call your primary care physician. They will put you in the right direction on whether you actually have symptoms or not. The protection of our first responders is paramount. They will be the ones needed if things get worse, and things could get worse. If we do get called, I want everybody to know what is actually going to happen. And we have this in place right now. We will be putting a surgical mask on the patient, and the paramedics will also be wearing a surgical mask to include eye protection, face mask, glove, and a Tyvek suit. We're taking this serious, and everybody else should take it serious too. I watched the governor last night, and I agree with almost everything what he said to do. Everybody needs to be doing social distancing, and call your parents. Those that have elderly, call them up. Don't go over. I think the best thing we can do right now is do a little distance, but still call them and make sure everything's okay. In closing, we have done a few calls in the city of Westfield that have had some signs and symptoms of COVID-19. I think everything that we're doing right now to keep, flatten the curve, I think this is going to help in the end. So that's all I have right now.
Thanks, Chief. Appreciate that. Chief Barrett.
Afternoon, Mayor.
Good afternoon.
Larry Valier, Chief of Police. I echo the sentiments of the fire chief. Westfield Police Department right now is up and running at full strength. We don't have anybody that's exhibiting any signs of any kind of medical issue. We are trying to limit the interaction that we do have with the public. We will answer any and all 911 calls, as we always do. We are limiting the access to the police department itself. We're trying to mitigate a lot of things over the phone that we normally probably wouldn't do in the past. We're encouraging the use of online reporting and just adhering to whatever advice we get from Board of Health. So also with LTCs coming up, if your LTC is getting ready to expire, call our department. If it's going to expire in the next couple of weeks, we'll make arrangements to get your application started, and you won't be, you'll still be good to go. If you have a new application, the department's not going to be accepting any new applications because there's fingerprinting involved. So we're going to stay away from that at least until the second week of April. And that's my report.
We're also joined by State Representative John Beals, who's going to give us a little bit of a state perspective right now. John.
Thanks, Mr. Mayor. Just want to get a little bit of a perspective of what's going on in the Boston picture. I know that ever since this past Wednesday, with the governor declaring the state of emergency, the governor's kind of been running point on most of the things that's happening. And I also just want to assure the public, everybody, that there's a lot happening in Boston. The legislature right now is dealing with many of these issues, and we hear you loud and clear, and I just want to give a couple of for instances. When the governor spoke last night, my phone immediately started chirping up with text messages and calls, and a lot of people raising a lot of legitimate concerns. If the kids are home and parents have to stay home, what happens to things like mortgage payments and rent payments and car payments and all of those things out there. Putting people in a situation of having to go to work to get paid, or we're going to work and potentially getting sick or getting people sick, or staying home and not getting paid. So as we speak right now, I know the governor was going to be filing legislation today dealing with unemployment insurance, a lot of the issues that affect our businesses that are being deprived of business right now with everything that's going on. And then there's any number of things that the legislature is doing, because one of the things about the state of emergency is that the governor has a lot of authority, but it's not unlimited. So the legislature is going to be stepping in and doing a lot of this stuff. Any things from moratoriums, there's been bills talked about moratoriums on foreclosures, car repos, things like that to get through this process. So the main thing that I want to convey today is that all of these issues that don't necessarily have to do with the virus, all the secondary effects, we'll say them, which many people have been reaching out about. We hear you loud and clear. There's talk of creating a fund to help people out, but following the science, following what the governor's doing as far as staying safe, but again, dealing with those unintended secondary effects. The legislature's on those things. We hear you loud and clear, and there's a flurry of activity going on right now in Boston, a lot of it remotely, a lot of conference calls with the governor, a lot of conference calls going on with legislative leadership. So we hear a lot of your issues. We're taking them up, and just please stay patient.
Thank you, Representative. Anybody else at the table have something else they want to add? Anything else need to be said? Stefan, go ahead.
Sure. I just want to add that the question so feeding students, and we have to be cognizant of that, as we know that many of our students do receive free or reduced lunch. And I know that we are partnering with the Boys and Girls Club, as Bo Sullivan is here also. So we will be feeding our students between 11 and 1 o'clock. Today we did it out of Abner and Franklin. We are going to be consolidating, or we're going to keep it both ways. Okay, we're going to keep it at both schools. And then the Boys and Girls Club is going to do a piece later in the day. If we could have Bo come up to talk about that would be great.
Grab a mic, Bo.
Thank you, sir. We actually just had another meeting with Ron, and we talked with Rachel early twice this morning. We are going to feed dinners at the club. Okay, I was quoted quite honestly in a couple papers that it was going to be at the middle school. We have changed that. All the meals will be at the Boys and Girls Club.
Grab and go, or actually
Grab and
at the
Grab
club?
and go.
Grab and go.
It's same thing. Nobody in the building. Nobody's coming in the building except for the few employees that we have there.
Very good.
It will be grab and go from 4:30 to 6:30. Will be when we do this. We will start tomorrow night. We've already talked to our vendors that we're going to have a big shipment done tomorrow. So the school department's been great as a backup if we need more food. We have gotten word from the state and from the state education department that we are now uncapped. Okay. This will be part of like what we do in the summer with our summer programming fee. That was capped. They have told us today that will be uncapped. So if there's people out there who need food, drive through the Boys and Girls Club, and we'll make sure we can do whatever we can until we run out. The only thing, and I've talked with both the chief and Captain McCabe about traffic patterns. If we could please just follow the traffic pattern from the club, that's going to be a big part of it. Everybody going in the same direction will help us out immensely, but starting at 4:30 to 6:30, and if there's still people in line, obviously after 6:30, we'll do the best we can to make sure everybody has it, but starting tomorrow night, we'll be able to. It'll be sandwiches, fruits and vegetables, whatever the Department of Education mandates that we do, we will do starting tomorrow night. All right?
Good.
So thanks.
Thank you, Bill. And thank the Boys and Girls Club.
I'm Ron Ricks with the school department. Just to piggyback on that, it's been a nice partnership because folks and families that came today to the schools got lunch today for the kids and a bag breakfast for tomorrow. Tomorrow when they come, they'll get the lunch and then breakfast for the next day. So partnering with the Boys and Girls Club, we're providing 3 meals a day to our families that need it. We're the same thing. It's the grab and go, both at Abner, Gibbs, and Franklin Avenue School.
Okay. Thank you, Ron. Anyone else? I also got a call from Mike Knappich from Bay State Medical Center, and Ron Bryant from Bay State Noble will be contacting the city probably tomorrow, Joe. If Joe's still over there, and just kind of working with us and giving us sort of an update about what's happening at Bay State Noble and how it can interface with us here in the city. So that'll be happening most likely tomorrow. Bob McKean had also contacted me from Stanley Park. If you've seen You might have seen something on Facebook or in the newspaper. Maybe it's not in the paper yet, but unfortunately, Stanley Park is typically not open at this time of year yet anyway, but they are definitely not open now because of the coronavirus. They talked it over amongst their board, and they realized they have no way of keeping the apparatus, the playscapes and things like that clean, so if children and other people use them, they're afraid that there might be some transmission that way. So the park will be closed. There are still plenty of municipal parks that are open. If people want to get outside and enjoy the beautiful spring weather, there's plenty of places to go and enjoy that in the city of Westfield, but Stanley Park right now is closed. I think that's all I had for other messages. Obviously, things are moving fairly quickly. If you watch the news at home or reading the papers, you see what's going on both at the federal level and the state level. We're taking our cues from the governor and from the Department of Public Health. We're taking them here locally and from the CDC at the federal level. So we're going to follow what they say. There will be conversations about what to do with City Hall, what to do with school committee meetings and city council meetings, as we talked about. Some of this will change. So we would just ask that you be patient, that you follow up with us maybe by sending an email or contacting the mayor's office. 572-6201 is our telephone number, or by looking at the city website and trying to get information that way. We'll do our best and get it out there. I know things will change and people will have questions, and we'll do our best to try to answer those. As Jim said earlier, we're going to start tomorrow with the conference calls for the department heads so that people can weigh in and check in about just the status of things here in the city. We're a good city. We'll be able to work with each other and try to make sure that we take care of any of the needs that may be out there. In the meantime, just try to be patient, try to be calm, and understand that nobody's ever kind of gone through this before, so we're kind of figuring it out as we go. And I'm confident that we will be able to do it. I want to thank everybody for coming in this afternoon, sort of on short notice, and I hope you get a chance to watch this on Channel 15. If there's nothing else, I'll say we're adjourned for the afternoon. Thank you very much. Good afternoon.
Thank you, Mayor.